Good afternoon, everyone. Thank you all for joining us for the coronavirus webinar series. We appreciate your attendance today. A few people more are still signing on as we get ready to start the presentation. My name is Henry Okonkwo. I'm the Chief Operations Officer and Chief Medical Officer for Skilled Wound Care Surgical Group. And I want to thank you all today for attending the COVID-19 and skilled nursing facility presentation. Once again, thank you all for attending, and please look forward to this webinar series. We'll be having a few more of these over the next coming weeks as we get more familiar with the coronavirus and get familiar and comfortable with having and managing coronavirus positive patients in our facilities. In a few minutes, I'll have Dr. Anvar give us a few comments. But first and foremost, I wanted to say thank you to each and every nurse out there managing patients in the hospital, the skilled nursing facility, assisted living, and everywhere that you're doing work. Just like in this picture here, you have one doctor in the image, but the rest of the people there and doing the work are nurses. And nurses are priceless to the healthcare system, and we appreciate each and every one of you, and we want to thank you for all of your work and energy. Before we get started with the presentation, I'd like to have Dr. Anvar give some comments.
Thank you, Henry. This is Dr. Anvar. Thanks everybody for attending. I want to second Henry's comments. I want to thank everybody for everything they're doing for patients. We know that everyone is making a sacrifice, taking care of patients today, no matter where they are. And we're really learning more and more about this disease on a daily basis, and we want to share that knowledge with everyone that we can. Henry and myself, we have done extensive research on how to best handle the situation, and we're learning new things. So what you will see with this virus changes almost on a daily, weekly basis on how to best manage it. And so a lot of the information is coming in, and there's a lot of information out there. But I also want to thank all of our physicians that work with us, all of our staff at Skilled Wound Care, who are on this call as well, on the webinar as well. Thank you everyone for everything that you're doing. And I'll let Henry begin, and go ahead, Henry. Thanks.
Thank you very much, Dr. Anvar. Just as a reminder, as we get started with the webinar, if you have questions at any time during the presentation, please feel free to type that into the questions section on the bottom right-hand side of your screen, and I will stop along the way and answer your questions. So thank you. Let's get started. All right, so as we know, everyone around the world is dealing with this pandemic, and everyone is doing their best to manage it. So what we want to do is really talk about what are the different things that people are doing. As we know, people out there are wearing masks when they go out, or they're staying at home, they're socially isolating themselves. And we want to encourage everyone to continue to follow the guidelines. We have doctors and researchers that are out there trying to do everything they can to learn more about the virus and keep us all updated every day. We have those in the front lines in the hospitals that are managing patients. And then, of course, all of us in the skilled nursing facility arena that are now starting to receive a large population of positive patients as we start getting ready to learn how to manage them as well. So as we continue to navigate through this really unprecedented time in healthcare, where things are evolving so quickly, it's important that we're as knowledgeable as possible about all of the different things that we're doing and that we're managing and seeing. I think someone's on the line that's not muted. Please mute yourself. So let's first talk about the virus itself. and getting just some basic ideas and understanding of what the virus is. I think that's extremely important as we move forward, so we have a ground foundation, a good foundation on the virus and how it spreads and why it's so dangerous. So the virus, otherwise known as coronavirus 2019 or COVID-19, is an acronym for the actual coronavirus 2019. The CO stands for corona, the VI stands for virus, and the D for the actual word disease. It was formerly referred to as the 2019 novel coronavirus, otherwise known as 2019 nCoV, but has since recently been called COVID-19 as its most widely used abbreviation. And what it is, the key word is that it is a novel virus. It does infect the respiratory system and it can spread person to person. But really what makes it so dangerous is that it is novel, novel meaning new. Our bodies have never seen this before, which is why as it's infecting people, symptoms can range from no symptoms to death for certain people, because all of us respond differently when when our bodies come in contact with a new organism. The organism was first identified in Wuhan, China, last year in 2019, and since then has spread to every continent in the world. Believe it or not, prior to COVID-19, there are also 6 other coronavirus versions that are out there. The first 4 are really the most common ones. They're non-threatening. Most of the time when anyone catches them, you get more of just flu-like symptoms, and that's it. It's nothing very severe at all. And so those 2 alpha and beta versions are the 4 most common versions of coronaviruses that most people will come in contact with. So it won't be unusual if someone comes into your facility and they're coronavirus positive. It's important to read to see what type of coronavirus that you're dealing with, because many of our residents have showed up coronavirus positive, but they obviously weren't COVID-19. The other 2 other versions other than COVID-19 it existed prior to, which was the MERS. As you guys know, that was a major outbreak in the Middle East that unfortunately killed a lot of people. And then the first original SARS COVID infection that came out in 2003, which killed a lot of people, unfortunately. Currently now we're dealing with COVID-19, otherwise known as SARS-CoV-2. And all of us in the United States and around the world are doing our best to learn as much as possible about it and prepare ourselves to manage it in every way possible. Unfortunately, what has been discovered with this virus is that those that are highest at risk of developing the infection or even succumbing to the infection are the elder and geriatric population. It's been shown that 8 out of 10 individuals that are infected, meaning 80%, tend to be 65 years and older. They tend to have multiple underlying comorbidities such as heart disease, diabetes, lung disease, or be immunosuppressed. And so those symptomologies and those comorbidities, and along with age, really puts the population of patients that we're managing at very, very high risk, which I'll talk more about as we move on. So let's talk a little bit about some of the signs and symptoms of COVID-19. It can range from a wide array of symptoms. The majority of us that will get exposed and eventually infected will have no symptoms at all. And then some of us will have mild symptoms, and then others will actually get very severe illnesses and end up in the hospital. And then a very small population of us will may unfortunately succumb to the infection and die from being COVID positive. The danger with COVID is that in the early phases, it does look like other common symptoms that we deal with, such as the common flu and also allergies. Someone has a question. Let me see if I can answer that. Gabrielle Martinez asks, I have a question. Ophthalmologists have noticed pink eye in patients and it's transmitted via nebulizers of the COVID positive patient. Have you noticed any wound changes or being contaminated by COVID-19? Great question. Gabriela Martinez asked about ophthalmologists seeing pink eye in patients that has been infected with COVID-19 after using a nebulizer treatment. Have we noticed that in patients with wounds? Currently, not yet. Later, I'll talk about how the infection is spread, and hopefully that'll bring a little bit of light to it. But we have not seen any physical changes yet in wounds in patients necessarily that's been that are COVID positive. The changes we're seeing in wounds that for patients that are COVID positive are due to the fact that they're not offloading as well during the time of infection because they're under quarantine and you know, they're depressed, so they stop eating. So their protein and albumin start to drop and they start to break down, and that unfortunately undermines their wounds and ends up resulting in them in their wounds worsening. So those are the common things that we're seeing right now, but not necessarily that the wound site has evolved because it's been sort of inflamed or infected with the COVID virus at this time. But we do expect with time to continue to learn more and see if we are seeing any evolution specifically associated with the organism infecting the wound, if that happens at all. So one of the other things to keep in mind is that symptoms can occur anywhere between 2 to 14 days after exposure, and those symptoms can range from fever, cough, shortness of breath. In some people, they'll get headaches or body aches, they'll get sore throat, even feel fatigue, and in some patients, diarrhea is actually a symptom as well. So, but there are symptoms that we want to be mindful of, especially more severe symptoms that can result in quick hospitalization, such as difficulty breathing or shortness of breath, persistent pain or pressure across the chest, your patient suddenly having confusion or an inability to be aroused, or having bluish lips or bluish face. Things that are showing that they are developing an acute respiratory distress. And so those patients need to be emergently sent to the hospital because they will need to be put on a respirator right away to prevent the infection from spreading and killing the patient, or at least to stabilize them as the infection starts to spread and prevent it from killing the patient. So as we talk about that spread of that infection, when it does actually get into the airway, getting into the lungs, it will result in a pneumonia. And if not treated quickly, that pneumonia can result in death. And when you get that exacerbation of that pneumonia, you get what's called the actual SARS-CoV or CoV-2 version of it, which is a severe acute respiratory syndrome of the coronavirus. And that occurs because the actual virus, when it causes the pneumonia, it doesn't just affect part of the lung, it likes to infect the entire lung, the entire airway as a whole, resulting in diffused inflammation. And that diffuse inflammation feeds itself, further irritating the nerves and the airway linings, causing even more inflammation, causing the pneumonia to become even progressively worse, which potentially can result in the patient dying. So what can we do as healthcare providers to avoid some of the serious potential medical issues that are associated with being contaminated or exposed? Obviously, number one is wash our hands. In the general population, we want to avoid direct contact with people and stay 6 feet apart, which is what social distancing is. And I'll talk a little bit more about why the 6 feet rule is even in place. Put distance between yourself and others who are COVID positive. That's really important, of course. And we'll talk about how that's going to be done a little bit later in this presentation. Make sure that you're cleaning and disinfecting areas that are high touch or things that you're frequently coming in contact with, like doorknobs. Avoid, obviously, any travel, if at all. So anything that's considered non-essential, such as cruises or just getting on an airplane. And of course, making sure that if you do feel any underlying symptoms, that you inform your primary care provider right away, so that way they can direct you to where you can get some assistance. So the biggest challenge for all of us in healthcare is that social distancing is extremely difficult because we have to manage patients. We have to get close to them. And getting close to them meaning that we're going to be much less than 6 feet apart. And generally, we're within inches apart from our patients as we're trying to manage them. And so that creates a problem because, as you know, now in the hospital, PPEs are in short supply. The hospitals are around the world are using a ton of supplies just to help protect themselves from patients that are acutely positive and acutely expressing symptoms. And so where the World Health Organization has estimated that on every month, frontliners are using over 89 million masks, 30 million gowns, 1.5 million goggles, 76 million gloves, and over 2.5 million liters of hand sanitizers. So that's a lot of equipment that's being consumed on a daily basis, by people in the front line. And so it does make it difficult to get appropriate PPEs for each and every one of us. And one of our presentations we'll be talking about in the near future is how to manage patients and good infection control techniques under these circumstances. So look forward to that in the near future. So regardless of whatever of all of the different guidelines, the most important thing that we can all do, and I say that really, really critical, is to make sure that we are washing our hands. Hand washing is super, super critical in this entire process in helping to prevent the spread of the infection to yourself and to others. So please continue to wash your hands as much as possible. That's really important. So let's talk about the virus and now how it spreads. So the virus does spread mainly from person to person, and generally between persons who are in close contact with one another, less than 6 feet apart. The respiratory droplets from a person is how the virus is actually spread. So when you have a person who is infected, now you can only get the infection from an infected person. So when an infected person does cough or sneeze, they do release droplets that are contaminated with the virus into the air, which unfortunately, if you're nearby, you can aspirate. So you can get those droplets onto your nose or into your mouth and inhale it, and it possibly can get into your airway and lungs and result in an acute infection. Now, something interesting about the virus is that it does spread person to person, but the rate of spread and the easeability of spread has been variable regardless, depending on the person. Obviously, as we noted earlier, those that have underlying medical conditions seem to be easier to contract the virus and be affected by the virus versus those who are healthy. But we've seen a wide array of positives from healthy adults to unhealthy young adults. So it does not really have a specific type, but the higher population are those who have been immunocompromised or have multiple comorbidities. But one thing has been consistent about the way the virus spread is that it does spread easily and sustainably within communities. So there's a terminology known as what's called community spread in epidemiology. And so what community spread is, it means that people have been infected with the virus in an area, including some who are not sure how they got infected, but they know that they were in this group area together, which is why crowding and getting a lot of people together has been a huge taboo during this process, because a lot of people end up getting infected but don't even know how they got infected because they didn't feel like they were around anyone who was sick. And so that's really the key. And so when you have areas like New York, which is really the epicenter at this point of the coronavirus, and you have a lot of people that are congested into one area, it's easy to see how infections and organisms can pass without people realizing it, and they're getting contaminated with each other. And a good example of this is recently, a few weeks ago in Georgia, specifically Albany, Georgia, which is a small community of, I forgot what their total population is. I think it's about 9,000 or something people, where 200 people attended 2 funerals over a 2-week period back to back. And after that 2-week period of attending funerals, within 2 weeks after that, over 600 positive cases of coronavirus suddenly appeared within their community, and 24 people had already died. And so it really speaks to the heart of the community spread and virulence of the disease. It does benefit from social contact. And part of that is because when you attend things like funerals, like you can see in this picture, you're hugging people, you're holding people's hands, you're kissing people on the cheek or even on the mouth. And so there's a lot of opportunity, and you're crying and you're blowing your nose. So there's a lot of opportunities to spread fluids from one person to another unintentionally, just through close contact. So let's talk a little bit more about the how with regards to the coronavirus. So as I mentioned earlier, the big how is when you have an infected person who sneezes or who coughs. And when you sneeze, you propel, obviously, organisms into the air. When you cough, even if you're covering your hands, you can cough directly into your hands, and eventually you can come in contact with someone else. But let's first focus on those who do sneeze or cough out into the air. And now you have respiratory droplets that are floating around that potentially could be inhaled by someone who's nearby, and then it gets into their lungs, and then they get the actual active infection. And so that's the danger with proximity. And so and then when it gets into their lungs, as we talked about before, it can eventually result in pneumonia and potentially SARS and then death. So that's what makes it extremely dangerous. Now, the biggest and most common way in that community spread where people end up contaminating other people unintentionally and without realizing it is not only as you sneeze or cough, but also hand-to-face contact. When you're coughing into your hands, or you're or others are doing the same, or you're wiping the sniffles off your face, you then may touch your face or touch the face of others, or you may handshake someone, and when you do, now they have those droplets on their hands, and then they touch their face and hands. There was a recent study that showed that nurses, on average, unintentionally touch their face 25 or more times a day in an 8-hour shift. Just because, even though we're mindfully, all healthcare providers, we're all trying to mindfully keep our hands away from our face, but we just don't realize how often we do. So you can only imagine how often the general population puts their hands on their face, near their eyes, over their nose, over their mouth, daily, where you can self-contaminate yourself after your hand has been soiled by coming in contact with some component of the virus, either by handshaking or touching a contaminated surface. So you can imagine, for example, someone went to the ATM machine, and while they're there, they cough or sneeze, and even if they sneeze over the buttons or they cough on their hands, and then they start pushing the buttons, then you come by right afterwards, and then you start to withdraw money, there's always that chance of cross-contamination onto your hands, and then you might unintentionally put your hands to your face, your nose, or your eyes, and then pass the contaminant there. You can be in an elevator just pushing the button on the way up, and someone may have previously contaminated the surface, and that can be an opportunity for it to pass. once again, and that's an important thing. So a lot of it is so incidental. You're in a subway or on a bus and someone coughs, and then after they cough, even if they wipe their hands on themselves and then still touch the railing, there might be remnants of the fluid onto the actual metal railing, and then you unfortunately touch the railing unknowingly right after they get off, as you take over their space, and eventually, unfortunately, end up contaminating yourself. And of course, the most common one is the doorknob. We got to get into it wherever we are going to, and grabbing a doorknob is one of the most common ways to pass on the organism. If someone has sneezed and coughed and then grabbed their doorknob, and then you grab it right afterwards, and then you put your hands to your mouth, your face, your nose, and potentially contaminate yourself at that point. So all of these ways are very common because we're all sharing the same things. And that's the idea behind community-based spread, is that we're all touching the same thing, and it just takes one or two of us who has an infection who can seriously spread it to others. So it's just important to be mindful. Do your best to keep your hands away from your face as much as possible. That way you don't accidentally cross-contaminate yourself. And it's not so much you touching your face, but it's potentially your hands getting close to your mouth or your nose or your eyes, and that ultimately resulting in potentially you causing an infection. Now, the other challenge, and it's kind of discussed here in this New England Journal of Medicine paper that was released not too long ago, and it was also supported by CDC. It talked about how long the organism can live on different surfaces, because that's one of our biggest fears, right? I just talked about all the different surfaces we're touching, and potentially, after we've touched those surfaces, passing on contaminants to ourselves. And so the study looked at the airborne virus and how long can it stay in the air. It says it can stay in the air for up to 3 hours. And then it says it can stay on copper, which would be the equivalent of a penny, for up to 4 hours. It can stay living on cardboard for up to 24 hours, and then on plastics and then on stainless steels, 2 to 3 days. And that's a significant amount of time for it to be living on a surface. And so obviously that makes everyone extremely nervous, and that's why the recommendations for cleaning surfaces during this time, during this epidemic, is really important, to constantly clean surfaces. And you want to make sure that you're using something that has 70% or more alcohol in it to be very effective, or bleach obviously is very effective. So wiping down all surfaces is critical to this whole infection control component. One thing people forget is their phones. We put our phones and lay it everywhere. We're touching it everywhere. And we're sometimes letting other people even handle our phones. So please do your best to keep your phones as clean as possible, because that's a very quick way to go from hand to face contamination. Okay? So we're now dawning on a new era where shaking hands, at least for the near future, is becoming and will be a no-no. And even fist bumping is now a no-no. And so we will start to look for new ways to greet others and say hello, whether it's by waving, saluting, elbow bumping, and all of the other different options out there, or sometimes just giving people the what's up, right? We want to make sure that we're just trying not to touch other people as we try to social distance in an effort to reduce the chances of passing on the virus. And so that is sort of our new reality. Now, we know that in the future, things will change, but in the current epidemic, these are become very acceptable ways to communicate with people. But more than that, once again, the most important thing that you can do is wash your hands. That is so critical to keeping yourself safe and keeping others safe. The more you wash your hands, the better. And of course, when soap isn't available, that you're using hand sanitizers to keep your hands as clean as possible. making sure that you're using hand sanitizer that has 70%. Even the guidelines for CDC say 60% ethanol or 70% isopropyl alcohol. So any of those or higher is always going to be the best. That's really, really important. And then if you can, get something that will hydrate your skin, because all of that alcohol, you don't want it to break it down. And so you want things that are also hydrating at the same time, such as the product we have here. If you are symptomatic, or you suspect that you've been exposed, or you suspect that your patient has been exposed, or that your patient is symptomatic, please get them tested or get yourself tested. And that's really important, because you don't want to actively be infected and feel symptomatic and pass it on to others, or others that may be actively infected and symptomatic and pass it on to others. If you turn out to be positive, you want to make sure that you self-quarantine for 14 days. If you're exposed but asymptomatic, meaning no symptoms at all, you still want to self-quarantine for 14 days. If you live with other people in your home, then you want to wear a mask the entire time. That's important because you're trying to protect others that you live with. And so wearing a mask keeps others around you very safe. As well as, of course, wash your hands and use hand sanitizers as often as possible. So let's talk quickly about how easily the virus is spreading across the United States and kind of put all of this into perspective. So we'll look at some of the CDC updates and guidelines. I'm a big fan of how CDC has done an awesome job at really keeping information consistent, truthful, and up to date as much as possible with what's going on around the United States. So let's look at some of the statistics out there. So a week ago, I did a presentation for our team, for our surgical practice, and all of our doctors, reviewing some of the updated data. And weekly, I do give updated information to all of them in our training sessions on coronavirus. And so that's important for our practice. But I wanted to use some of the data, retrospective data, to sort of give you an example of what's happening currently with the virus in our space. As of March 28th, there were only across the United States reported 103,000 plus people positive with the infection, and only 1,668 deaths. Since then, as of yesterday, April 8th, CDC has reported 3,905 deaths. I'm sorry, and 12,000 plus. I'm sorry, over 3,000, over 300,000. Let me clarify that: 395,000 positive cases and over 12,000 deaths throughout the United States. So you can quickly see the surge. Last week, we spent a lot of time educating and training our staff because we anticipated that we were going to be seeing a surge of positive patients this week, and also the second version of that surge going into next week, which is why we thought it was really important to do a webinar for our facilities as well. But you can clearly see there's been a threefold increase in the amount of positive cases just within a 10-day span, from last week to this week. And so that's really, really indicative of what's actually happening and the surge that's going on. And so when it's broken down by where those cases are happening, it's been shown that about 1,800 of them are due to travel-related contamination. Close contact, about 8,000, and the remainder of the 380-something thousand are still under investigation, where the federal government is still trying to figure out how do these people get the infection. But we know that most likely it's through one of the reasons that we just discussed above, which is by contact from hand to face or close contact. So I wanted to share a heat map with you of the United States with some of the major areas where we're seeing major epicenters in the infection. And so just to sort of bring it more into perspective as well, because we know we have people on this webinar from all over the United States, and we do appreciate each and every one of you joining us. So let's just share some of the stats. A week ago in the United States, specifically in California, there are only 6,900 plus cases of coronavirus. But since then, as of yesterday, there were 15 plus thousand patients that were positive with the coronavirus. And then moving over to the East Coast, in New York a week ago, there was only 67, which is why New York has been an epicenter, 67,000 positive cases. And then, but as of yesterday, 138,000 positive cases. So you're seeing within a week a twofold increase in the amount of positive cases in each of the high population areas. Looking at New Jersey, 37,000 cases a week ago, and now 44,000 cases. So you can see there over 10,000 new cases being discovered just in New Jersey. In Maryland, 777 cases, 774 cases a week ago, and now Maryland has reported 5,529 cases. That is a tremendous growth spurt of positive cases that they've experienced there. And in Texas, we have a week ago 8,262 cases, and since then, hold on a second there, it's now 2,877 cases a week ago, and now it's 8,262 cases now. Sorry, I had that set up backwards there. Sorry for any confusion. But as you can see, it's been a huge growth spurt from then to now. I mean, from back a week ago to now. And then in Louisiana, recently, currently 16,000 cases of coronavirus, which is really, really high. And in Illinois, over 13,000 cases as of yesterday as well. So across the United States, we've been seeing nothing but a surge of positive cases. And as you can see here on the graphical representation, the surge continues to elevate. So that high surge that we're seeing now is indicative that we're getting to most likely what the US feels is we're moving towards the potential peak of the virus and infection across the US. One of the other things CDC reports is what's called date of illness onset. So where they're looking at when you were tested positive versus when your onset of any illnesses may occur. So there's generally a lag behind that you'll see where the surge will be a little bit delayed with comparison to how many positives. But this is important because what you want is, it's one thing, it's okay, it's better to have a lot of positives that are asymptomatic, which is what we're going to expect the majority of the world to have, and not have those that are symptomatic, because those are the ones that, number one, the virus is more virulent in those and it's easier. Those are the ones that are more likely to pass it on to others, and also more likely to get sick and be hospitalized. So one of the things that's important that I like to look at, I think it's important to share to kind of bring all of this information together. When you're looking at a pandemic, there's a lot of different phases of the evolution of that pandemic. There's what's called an investigation phase, recognition phase, initiation phase, acceleration phase, then deceleration, and then preparation. And so it's been shown that the majority of the United States, which are not those hot spots that I mentioned, are mostly in an initiation phase. They are more in the earlier phases of their infection. So you're seeing now places like Georgia where they're having a bloom of positives versus when you have places like California and New York Illinois, or Texas that are clearly already in their initiation and in their acceleration phase. So when you have those that are in their acceleration phase, the next thing to anticipate is what's called a surge. And that surge is when you suddenly have those multiples of positives, which we've seen over the last week and expect to see over one more week, where you're going to have this great surge of positive cases that are going to show up. And what you're hoping is that there's not as high as many people that end up becoming symptomatic over that time. So it's important to be mindful of this surge, because this surge will eventually also come into the skilled nursing facility. So we in the skilled nursing facility world manage the most at-risk population of patients for COVID-19 infection. We do. We have it. When you look at all the symptomologies, you look at all the comorbidities, you look at all the risk factors, those are the patients that we manage. Those are the patients and the residents that we care for. You know, people above the age of 65 and older, high risk. People who live in nursing homes and in long-term care facilities or in assisted livings, high risk. So the CDC and the federal government reports that. Other high-risk conditions include people with chronic lung diseases or moderate to severe asthma, people who have had serious heart conditions, people who are immunocompromised, including those who have cancer, even people who are morbidly obese, people who have a lot of other underlying conditions such as uncontrolled diabetes, renal failure, liver disease. These are pretty much the majority of the patients that we manage. Most of the patients in the skilled nursing facilities have multiple comorbidities that fit this profile. So we are managing the highest at-risk population for getting COVID-19. So we have to be extremely very mindful and concerned of this surge that's going to happen within our skilled nursing facilities. You know, when I talk about the surge, it's not like I'm talking about the end of the earth. It's more of just talking about anticipating that we're going to get this high population of patients that are COVID positive that's going to end up in our facilities. And I'll talk about the different reasons why and how that's going to occur. So let's take a look at the hospitals. We know that the hospitals have already anticipated or already experiencing their acceleration phase. And as they continue to get to near the peak of their acceleration phase, soon they will start hopefully decelerating. But one of the consequences of deceleration is to the skilled nursing facility. There's what's called lag behind. The skilled nursing facility generally will always experience a lag behind in time and experience when it comes to the acute care. Hospitals get it first, nursing homes get it second. It's called downward pressure. It generally always happens, and it's very consistent. The science remains true. And so with lag behind, it really is defined by what happens either when to move or to happen at a slower pace than someone or something. So when we think about our nursing homes versus the acute hospitals, right now the hospitals are inundated with patients. They have way more than they can treat or manage, and they're going to have to do what? Start sending patients out into the community in effort to make space for even more acute patients. And that's what we have to start preparing for when we talk about lag behind. So our goal is we want to try to get all of our SNFs up to speed by educating and sharing information and preparing as many people as possible to be on board. So as the surge does occur, we'll be ready. So because our acceleration in the SNF with our surge is going to start happening. And I can validate this. You can see this around the United States. And I'll show you some clippings in a few minutes. So one thing that's really important, bear in mind, as the hospital starts seeing a decrease in cases, nursing homes will start continuing to see an increase in cases. And why is that going to be occurring? So what are some of the things that's going to cause that? So as I said earlier, hospitals are stretched. They have way too many patients to manage, way too many COVID positive patients. And as they do, they're going to start prioritizing, which they're already doing, prioritizing the sickest of the sickest to keep, and those who may be symptomatic but aren't sick or as sick but are already COVID positive, they're going to be discharging them to the skilled nursing facility. And as they do discharge them, you can't say no. Guidelines are already being put in place to prevent SNFs from being able to say no. We have to take on these patients, and so we have to continue to prepare for it. So this will continue to be an ongoing problem as hospital beds stay full, and only will keep the most acute patients, and the remainder, they will start sending them out. So many will not, and then unfortunately, many nursing homes, you won't even know that you have a COVID positive patient that they're sending to you until you get the full medical chart. Or they may send the patient to you where they're saying that the patient's labs are COVID positive or COVID pending. So you don't even know what you're getting. You just know that you are getting a patient who's high risk. And you're seeing it now in the nursing homes. The trend is occurring all over the United States. Here's some newspaper clippings just to give you some ideas. 51 residents positive for COVID positive in a Wilmington home, despite having no symptoms. And so across the US, we're going to continue to see more and more of this. More than 150 nursing homes have reported COVID cases. Federal officials won't say which ones. Coronavirus outbreaks like wildfire at US nursing homes under lockdown. So you're going to start seeing a lot of these very sensationalized titles in papers, news clippings, and news reporting agencies. COVID-19 reaches quarter of New Jersey nursing homes. And so that's going to become a huge problem. The nursing home acceleration has begun, is what I'm trying to tell everyone. And it's important that we're mindful of it, because as we are, we can be better prepared. And that's really, really important. So we expect over the next week to definitely 2 weeks to have more and more surges of positive patients in our facilities. We have facilities already that we're managing where they have 45 plus positive cases. And we're all working together and collaborating to make sure that we're still giving the best possible care. We're designing protocols together to make sure that we're able to be as helpful as possible. Because one reminder that I give to everyone during this epidemic and pandemic is that we're still held to the same regulatory standards that were in place prior to the coronavirus. And we're also going to be held to those same ones even after the virus. So there are still facilities that are having their surveys actually occurring in real time and getting cited for not doing the certain things simply because they're focused on the coronavirus. So we all have to, start to embrace this new reality and get comfortable with it and start building protocols and systems around it, and make sure that we're training our nurses so that way we're as prepared as possible. And for any of you that are working with us in skilled wound care, and any of those of you that aren't working with us, that look forward to working with us in the near future, our goal is to collaborate to design processes to help successfully manage every patient you have, and number one, foremost, prevent them from being admitted to the hospital, because that is something we definitely don't want to occur under these current conditions. We've had a lot of cases that we've heard of, not in our facilities, but where people have went to the hospital and unfortunately did not make it back. So in California, there's already a case in Northern California, 51 residents positive in a facility. There's the county health director is considering, pulling residents from nursing homes, or trying to figure out what are the best options to manage residents who are in these highly condensed areas where it's easy to spread the infection, and what do we do? We are basically going to be the new epicenter. Soon, if not already, many of our patients will be COVID positive. We have to get comfortable with it and start preparing and knowing how to manage these patients when they come into our facilities. And so there is a positive side to all of this. It's not doom and gloom by any means. We are all healthcare providers, we're always prepared for these types of scenarios, and we've been preparing. You know, all of you have been preparing for weeks. You educate your nurses all the time. You give weekly updates or daily updates. And you're always beefing up your infection control protocols to make sure that everyone is prepared and doing the right thing during this crisis. You know, us in our practice, we've always been ahead of the curve, and we pride ourselves on that. We've implemented so many different things to help mitigate cross-contamination or infection, and we've also even designed some new protocols that we'll be sharing soon of how we're going to be managing patients that are COVID positive and still making sure we're getting great outcomes. One of the things we've done is we've truly embraced telemedicine within our facilities, and educated and train our facilities on how to use that as an adjunct for better care and for making sure that we can monitor and manage patients in real time, especially upon admission, and get great outcomes. And so one thing that's important in our practice is to still continue to be able to round on our patients when possible, making sure that we're providing the essential services and procedures that are required to keep them from being hospitalized. And so we've put systems in place and protocols in place to do that, which we're going to continue to educate and train our facilities on, some of which I'll be sharing with everyone and during our next webinar that we'll look forward to all of you attending, and we'll be talking about some of those infection control protocols then as well. So I'm nearing the end of our presentation, but one thing I think is important that I want us all to be mindful of, we really are now have officially joined the front line. We just tend to have been sitting back and looking at the hospital, and but we are, like I've always said to everyone in any of my presentations in the past, the nursing home is the new hospital. So it was only a matter of time that we are going to be the ones that have the highest population of COVID positive patients, or have a high population of them at least. And we have to get comfortable with managing them under every circumstance possible. So we encourage everyone to continue to do your part, and we'll all do our part in trying to manage and protect our residents from being COVID positive, and protect ourselves and in every way possible by continuing to sharing guidelines and policies and processes that can help keep everyone safe and get our patients better as quickly as possible. The reality is that viruses and bacteria are everywhere. They're on every surface, they're in the air we breathe. And so, you know, for that reason, it's important for everyone to just sort of be mindful and sort of calmly understand that COVID isn't going away. COVID-19 is not going away. It will just, over time, it will run its course. And so some of our predictions is that most of the nursing homes in the United States is going to have at least one or more positive COVID-19 case over the next few months. Most of us in the United States and in the world will eventually get exposed to the virus, but most of us will be asymptomatic because we're going to develop antibodies for it, and our body will know how to deal with it because it won't be novel anymore, it won't be new, and we will be able to fight off a standard infection without any major problems. Unfortunately, though, there will still be a high-risk population of patients, just like any other flu or any other high-risk infection. If you have a lot of underlying comorbidities, can predispose you to becoming very ill due to that exposure to that contaminant or that virus or bacteria, and it can result in death. But with the coronavirus, it's been predicted that potentially up to 100,000 or more people will die when it's all over and done with, which is really sad. But what we hope is that at least within the skilled nursing facility, we can continue to do our best to mitigate that number to the best of our abilities. So in conclusion, it is important to remember, as far as the virus is concerned, it is novel and it's new to our body, new to the space, new to the air. And for that reason, that's what makes it deadly, or that's what makes it dangerous for most of us. And so it is in the air. It can stay in the air for up to 3 hours. That's why we recommend that people wear a mask. You can get it from human contact, which is, believe it or not, the more likely way most people are going to pass it on in the initial phases. But after that, it will, of course, taper off. And then of course you can also get it from contaminated surfaces that haven't been wiped down. But as our body builds antibodies to all of this exposure, these levels of transmissions and modes of transmissions will obviously lessen and not be as dangerous. Currently, look for symptoms such as sneezing, fever, dry cough, shortness of breath as common symptoms for the coronavirus. And if so, and you're suspicious of it, make sure that you are at minimum quarantine the patient for 14 days, getting them tested if possible. And if they are positive, follow all of the standard protocols that you have in place. Prevention is the key for all of us. Number one thing you can do, wash your hands, cover your mouth when you do cough. If you do cough into your hands and not into your shoulder, make sure you wash your hands right away. And then of course, currently we're trying to do our best to do social distancing and not get in large crowds, and then cover our wear masks, protective masks whenever we can to prevent direct inhalation of potential contaminants from someone who is infected that might be near us. So I encourage everyone, continue to work together as a team. We're only going to be able to get through this as a team. So collaborate, communicate, and stay positive. That's really, really important. Doing that will help each and every one of you and all of us get through this, and all of your patients get through it. So we know that a lot of people will be sad and worried. You don't have to be sad and worried. Stay positive. This will not last forever. We're actually, as we're getting near the peak of it, we know that in the next couple of weeks, things will start turning around and looking really, really good. So stay positive. We do appreciate each and every one of you and all the hard work that you've put in. Continue to do so. Healthcare, unfortunately, is one of those fields where, you know, no one says enough thank yous, and you can never put in enough work. But it's very helpful because you're saving the world. So before I conclude, I'm going to answer some questions that people have. And give me a second so I can get to the questions. So Lourdes Lopez says, grateful for SWC rounds for your wound consults. Thank you so much, Lourdes. We greatly appreciate you. And for Armand Cruz, Dr. Henry, thank you for a very clear and updated presentation. You're so welcome. Thank you so much. Are you going to share the PowerPoint presentation? Yes, we are. We will be putting it on YouTube, I believe, on our YouTube site. So you will be able to share this with your team afterwards. So look for it. We'll probably send out a link to everyone who attended, and making sure that you can share it with your team in the future. And don't forget, we are having this as a series, so look for emails for those as well. And oh, thank you very much, Patty from Inland Valley, she's thanking us for the information. You're very welcome. We greatly appreciate you and all of your hard work. And Jasmine Martinez says, this was put together wonderfully. And thank you for the time and the education. You're so welcome, Jasmine. We greatly appreciate you. That's very kind of you. And Tyra says, thank you for the webinar. It was very helpful. You're very, very welcome, Tyra. We appreciate you as well. We appreciate each and every one of you. Like I said, we have a few education series that's coming up next week. Most likely next week, I'll be doing an update to the COVID-19, where we're going to talk about infection control in the SNF and managing COVID-19 patients. Tomorrow, Maureen Daly, who is our clinical nurse educator, will be providing wound care education on a webinar throughout tomorrow, all of Thursday, 3 times in 3 different time slots. So please look for the link. We'll make sure we re-invite you to those as well. Please attend those. They're extremely helpful. We still have to keep managing patients and learning how to manage patients in spite of the crises that we're in. So we want to make sure that we're doing our best to maintain our education level and continuing to learn. So make sure you attend Maureen's webinar tomorrow. The link will be sent out to you so you can join her meetings. And then next week, look for part 2 of the coronavirus education series as well. Thank you so much to everybody who joined us. We greatly appreciate you. As always, reach out. You can text me if you ever have any questions, text me directly, or you can call our corporate office and they can reach out to me if you have questions there as well. Take good care of yourself. This concludes our webinar for today, and we'll look forward to seeing all of you soon. Oh, wait, there's a couple more questions, sorry. Gabriela Martinez asks, is vitamin C and zinc recommended for wound care patients only, or should we add these to COVID patients? Yes, add them to COVID patients. Those two are immune boosters. And so high doses of vitamin C and zinc help increase your immune system and help fight off any common infections, included COVID. So there isn't specific research for those and specifically COVID-19, but in general, for all viruses and bacteria, having a high dose of both of those minerals and vitamins are extremely helpful in preventing infection because they are both immune boosters. And Sobide Molina, she asked, I tested negative for COVID-19. Okay, I tested negative for COVID-19. That was back in March. Now I've been coughing for the past 2 weeks. Should I get tested again? So if you tested COVID negative, 2 weeks ago or more than 2 weeks ago, and so CDC guidelines for being positive or being negative is you have had to be in quarantine for 2 weeks after potential exposure or a positive test. And then after the 2 weeks, if you've had no symptoms, you are considered literally infection free. You can come back into the community with no problems. But if any time during that 2-week period you start to develop symptoms, you have to reset your 14-day quarantine from the day of your last symptom. And you have to have a minimum of 3 days free of any symptoms within that 14-day period before you can come back out to the community. So for you who asked the question, since 2 weeks have passed and now you suddenly have started having a dry cough, more likely than not, unless you believe you were recently re-exposed, which they've also said that re-exposure is very unlikely for if you've already been previously positive. Now, if you were exposed but never infected and then exposed again, there is a chance you could get infected the second time around. So that would be different. So the key is paying attention to see if you were potentially exposed. If you're potentially exposed and now symptomatic, then you should quarantine yourself for 2 weeks. But if you're just suddenly having a dry cough, but were never and don't anticipate that you were ever exposed, then more likely it may just be a common cold or allergies that you may have. So great question, and I hope I answered it. And if I didn't, please type in another question into the question box so I can make sure I clarify for anyone who didn't understand my answer. Eugene Montebello, thank you, Mr. Henry, for the education. You're so welcome, Eugene. We appreciate you. You need the session. We will send out the link for Maureen's webinar tomorrow. So we'll send it out later this afternoon. So look for it in your inbox. So that way you'll make sure that you'll have access to that for tomorrow as well. So don't forget, Skill Wound Care every week for the remainder of the year, just about at least 2 to 3 times a month, we will be providing free webinars to everyone across the United States. So look for them, and they generally will occur on Wednesdays or Thursdays throughout the year. Maureen will be giving a majority of them. I will, upon having time, jump in and do some as well. So I'm always excited to do them whenever I can. And of course, we have our wound certification course and our other education days that we put out there that we'd love for you to attend live once all this is over. But unfortunately for now, we're doing everything by the web. So please continue to look out for those. And last question from Gabriela Martinez. She even wrote, last question, is there 8 strains of COVID, or is that a myth? Currently, that is a myth. it is not, it has not been validated that there are actual H strains. What has been consistent is that number one, there's 4 different responses to the current strain that is out there, and that's you get it, you get infected, you're asymptomatic, you never get anything, you never even know you had it, and you move on with your life. Your body builds antibodies and no big deal. Then you have those who get it and they become symptomatic, they get a dry cough or a cold, they get minor flu-like symptoms, and that's it, and it goes away. So basically you suffered through it the best that your body could, and it managed it really well, and then you build antibodies and now you're good. You've been basically auto-inoculated and self-vaccinated. Or you have the third version where you get very sick, you end up in the hospital, but you don't pass, but you require hospitalization in order to get better. And then you have the most virulent version where these are patients that have all those underlying comorbidities. They end up getting sick, they get the pneumonia, they get the SARS, and they end up passing. So that has been very consistent as far as what's out there, but no, there are not 8 strains that I have been able to come across and validate. I will continue to read as I do every day. And at our next webinar, I will keep your question in mind. And if I do come across something that is clear and validated with regards to strains, I will discuss that at the next webinar as well. So I definitely appreciate
Henry,
Gabriella.
Henry,
Yeah.
it might be that there's actually multiple coronaviruses.
Viruses, right. And there
There are
are,
multiple
remember,
coronaviruses, of which COVID-19 is one of them.
right. As I said in the very
And
beginning of the presentation, there's actually, with Corona, with COVID-19, there's actually 7, right? And the
yeah, there's
first
7.
4, yeah, the first 4 give you flu-like symptoms, and that's it. You get a common cold and you move on. The next 3, which are MERS, which was the Middle Eastern version, and then the SARS-1, which was the early version, and then now you have SARS-2, which is the COVID-19 version. And so those last 3 are the dangerous ones. The first 4 are the common ones. Like I said, you're going to see those common versions in your facilities. And so I'm sorry, I guess if that's what you were asking with regards to the strain, I thought you meant of this current COVID-19 strain. So thank you for helping me clarify that, Dr. Anvar. So with regards
Yeah.
to your question, I guess you were talking about the other general strains of corona. And so, yes, like as I showed in the second or third slide at the very beginning of the presentation, there are actually 7 different versions of the coronavirus. The first 4 versions is 2 alphas and 2 betas. Those 4 versions cause a general common cold, and they're common across the world and in the United States. Everybody comes across them and have been exposed or to those and have been infected by those at any given time in their life. The last 3 versions are the versions that cause pneumonia, and those are the less common and rare versions, and that's the MERS version, the Middle Eastern, the SARS, and then the SARS-2, which is the coronavirus, the 2019 that we're dealing with now. So I'll bring that up again at the next presentation. Thank you for helping me clarify that, because I guess I didn't understand your question. I thought you meant multiple versions of this very current COVID-19. And
Thank you. And Henry, if I could say thank you to you for making this presentation and spending your time today.
my pleasure.
Your presentations, as always, are excellent, so thank you. And I think we're going to continue possibly next week with going over how we're implementing telemedicine in a lot of buildings, screening patients that we're seeing for possible symptoms, so that we can continue to treat all patients. And let's remember, even if someone does test positive for COVID-19, whether they're a patient or whomever, most people will overcome it. So it's not that you're going to be positive COVID-19 forever.
Forever, exactly.
And so if a patient is positive for COVID-19, it's important to note how long they've had it and what their symptoms were and what their course was. They may have gotten over it. So we don't want to put patients in this category of like COVID-19 positive forever, but we do want to know that they've had it before or not and how long have they had it for, and making sure they've been isolated or put in special areas so that they're not passing it on to other people. And we are, like I said, learning more about this disease. The reason why people have a different response is, believe it or not, is a genetic predisposition on how you would react to this virus through your immune system. So some people will have a good immune response and feel nothing. Some people will have an immune response and have a lot of symptoms and overcome it. And some people will get a second phase where they get sick and they go on a ventilator. And fortunately, that's a small percentage of patients, usually around 5 to 10% of patients, but still, that's a lot of people. And so we need to be very careful because we don't know who is going to respond how, and even regardless of age. So as we learn more, what happens in the early phase is there isn't a lot of treatment out there right now. But if somebody is having progressively worse symptoms, most physicians are treating patients with all the drugs that we're hearing about. And it's important that if anybody does have symptoms, to monitor it very quickly. I know they're saying if stay at home and if you do have symptoms, but it's not serious. But if anybody is having difficulty in breathing or any serious respiratory issues, they should be going to the hospital and getting medication.
Go to the hospital.
And the medications themselves do have side effects. So I know we talk about hydroxychloroquine, but there are side effects with it. So it's not something that you can just get over the phone. So you do need to be evaluated by a physician, and everything needs to be taken care of.
Yep.
So thanks again, everybody, and thank you to Henry.
Thank you, guys. Thanks for attending, and looking forward to talking to you guys again in a week. Take care and have a great day. And we will upload this soon on our YouTube channel. Thanks. Take care.